clinic as a healthcare clinic is going to close. So this is wrong. So there is a few answers here too. I stand among 59 colleagues who are nurse practitioners in the community and in BC. We have been educated in BC. Part of your taxpayers' money helped to help my education. And we are standing here ready, able, poised, educated to take on healthcare needs like at the James Bay Community Project, but also the 400,000 population of British Columbians that have no access to a primary healthcare provider. There's many of you in here today that have no access to get in other than a walk-in or an ER, and we all know what kind of healthcare we get from them. So this again is wrong. There's 68 of my colleagues going to be coming out in the next year. We are not able to take on patients. I have people here coming up to me and saying, can I be your patient? And I'm saying no, unless this government comes up with some funding formulas that work, that we can provide care along with the established primary healthcare providers out there. There is a need, and I think that we provide one of the answers. So I think James Bay is a canary in the mine, and we're going down, and I think the mine is full of some real foul air, and that's our healthcare system. Thank you.
I've come down from Parksville on the bus. I am a disabled person. It was rather a hassle to come down here, but to me it's extremely important that we have the same healthcare system that was envisaged by Tommy Douglas. And the private for-profit healthcare is eroding the taxpayers' money, and it is basically selling future generations down the tube, and we can't afford to do that. And especially for people with disabilities, they're already not having their needs met, and that's already before becoming a senior citizen. So we have to have a healthcare system that is fair to everybody, and not just for those who can afford to pay to get their needs met.
I think the current government has decided that, as a political decision, that the direction that they would like to take our public healthcare system is away from being in the business of healthcare. You know, they would like healthcare to become an actual business where the private sector picks up where they left off. So choosing to do a number of things, to make the cuts where they're making, is creating a pressure cooker type situation in the province in terms of healthcare, where only the market can sweep in and help us. So certainly I think that they're actively engaged in creating the crisis, when we all know that the money is there for public healthcare, to fund services and facilities in the way that we need them to be for all citizens, regardless of their ability to pay.
So Oak Bay Lodge and Mount Tommy Hospital are a very good example of what happens when funding shortfalls for capital funding happen to healthcare. The Ireland Health Authority is being forced by the funding shortfalls to sell off these valuable properties that were given for future generations in order to finance their short-term operational costs. This is so short-sighted, it's so economically stupid that it's breathtaking. This government cut taxes during a boom time when we had no need of economic stimulus. They sold off public assets like BC Rail. They failed to set aside money for a rainy day, and now they are crying emergency and selling off our public assets again. It is naturally a zero-sum game. No business person in their right mind would sell their assets and lower their net worth, not unless they wanted to destroy the very foundations of their own wealth. But that is exactly what the Liberal government is doing. In my work as a founder of lands, I've seen these tactics over and over again, and I see them happening with Oak Bay Lodge and Mount Tommy Hospital. And I have a personal investment in this because Oak Bay Lodge is in my community and my mom lives there. And that means that I can visit her every day. She's close to my house. And that's how it should be to everybody in this province. That our elders age inside their community with the people who they love, running in and out to say hi for 10 minutes. It should not be that they're way in the distance. So the pattern is like this. First, you undermine confidence in perfectly sound buildings, often buildings that have been freshly renovated. Then you redirect seniors to other facilities to try to make it look like the buildings aren't really being used very much. and then you sell the property, and that undermines confidence in public health care. It's a pattern we see over and over again. And what happens when the privatization happens is the seniors end up in acute care beds at $1,200 a day. And who wants to be in an acute care hospital every day for months and months? It's a no fun place to be. People should be receiving the warm, loving, nurturing care that they're getting right now in the public care of Mount Homie Hospital and Oak Bay Lodge. Universal health care is a cornerstone of our society, our economy, and our democracy. Like public education, it provides a powerful platform and stabilizer on which we can build our lives, our businesses, and our future. And like public education, we see it being starved. These lands and these hospitals belong to future generations, beyond our ability to foretell. The sacred trust of public health care belongs to future generations. The lands and the health care both belong to the future. They belong to our great, great, great grandchildren. They are not ours to sell.
The pending privatization of Oak Bay Lodge is a real tragedy. Oak Bay Lodge is a facility that houses nearly 300 senior residents, people who have a variety of special needs, long established in the community, and without any kind of consultation in the last month or so, the Vancouver Island Health Authority, on the direction of the Liberal government, have announced they want to privatize it. Oak Bay Lodge is currently operated by a society, the Oak Bay Lodge Society. It's well represented by members of the community. It's well thought of in the community. It's a bit of an icon in Oak Bay. It's been around since the mid-1970s. About 270 people work there. They care deeply for the residents that call it home. And unfortunately, we don't know what the future is going to bring for the facility. It appears that if the facility is privatized, residents may be forced to move. They may be forced to move anywhere in the Capital Regional District. It's not entirely clear if there's a location that the new facility might be built, or if and when those new beds would be built. It almost guarantees another 3 or 4 years of uncertainty for people who currently call Oak Bay Lodge home.
On the surface, we're seeing cutbacks. BC is having an overrun on the Olympic expenditures, though they insist they're not. And there's been a certain amount of things built, like highways and so on, that demand a lot of money. And so the easiest and most vulnerable place to take the money from is, of course, the healthcare system. Ill people have a hard time spending a lot of time complaining, writing letters, knocking on their representatives' doors. And so it's an easy target.
I don't need 2 minutes. I can do it in 2 seconds. The problem is the Gordon Campbell government. Now, I'm not joking about that. This is National Medicare Week. And in many ways, what we really celebrate this week are the 5 principles outlined in the Canada Health Act: public administration, comprehensiveness, universality, portability, and accessibility. These are the principles that help Canadians define who we are. And of course, it is the role of the provincial government to provide healthcare funding that enables the healthcare system envisioned in those 5 principles.
I believe that there's an element of the system being undermined so that by privatization, because if you starve the system long enough, then people are going to say, okay, you win. The public system is not working properly, and therefore we'll save our money up and we'll go toward what the American system's like now, and we'll pay money out for private care.
Public health care is by far more efficient and cost-effective than the private system. Studies across the world will show that. In fact, you would be hard-pressed to find a private system which would reflect more